to analyze a crucial aspect of safety standard analysis, but easily to be ignored most of the time, through introducing the distinguished research, health and safety risk analysis, information for better decisions, of Professor Lester B. Lave, one of the leading environmental economists. It's easier for us to understand how risk analysis really contributes than starting with introducing two real-life scenarios. First, you have a partially blocked coronary artery that can be treated by bypass surgery or medication. Although there's a chance of dying during the surgery, if you survive, you can expect less pain and more active life than from the medication. Second, your neighbor's school contains obstacle materials. School officials can ignore the problem or pay for the removal of the obstacles with the funds of educational programs or a special property tax. Uncertainty is introduced and the trade-off has to be made in both cases. In the first case, you trade off between accepting the uncertainty of dying and of a more active life. And in the second, school officials trade off between the risk reduction of removing obstacle materials and the opportunity cost of funding at other purposes, like education. Therefore, the characteristics of risk would be clear from that. From those examples, the first thing we can conclude is that intelligent decisions are needed, on which potential hazards to ignore and how much risk reduction to seek. Despite the decision processes are generally complicated, these decisions require information about the nature and the probability of hazard, how the risk is perceived, and safety goals. More importantly, regarding safety issues, people generally feel deeper and become uncomfortable when thinking about situations that involve danger to themselves or their children. Second of all our analyses are based on a basic assumption: all candidates are rational. People have to select the better alternative if they can. During the trade-off process, we can find out that each successful reduction in risk generally achieves a bit less and costs a little bit more. From that, we can conclude risk analysis help identify significant hazards, stimulate basic research, and spotlights the need to agree on healthy goals and priorities. In medical scenarios, the importance of risk analysis is emphasized based on the specialty of the medical problem. Although quantification of probabilities simplifies some dangerous diversifications, some individuals are still at extraordinary risk. For instance, the chance of death during the surgery would be much less for a 40-year-old in good physical condition with no other medical problems than for an 80-year-old with a severe deterioration of the heart muscle and an experienced surgeon. Therefore, an individual's perception of the value of outcomes and the desire for sanity are important determinants in decision, since there are no single optimal decisions for all people. And this indicates the key issues in the medical decision-making. There is always uncertainty regarding the range of outcomes. Occasionally, decisions are as simple as treating a broken bone. Information is good, treatment is beneficial and carries few complications, and there is a dominant decision. More generally, getting the right information is difficult or impossible. For instance, the bypass surgery. No matter how professional the doctors are, there are always 1 or 2 patients died out of 100. This depends on the individual health conditions, and this is where the complications come from, which restricts the decision-making to be simplified or standardized. Due to the uniquenesses of medical problems, risk analysis has enlightened decision-making by allowing quantifications of the chances of adverse outcomes and promoting the evaluation of treatment modes and individual performers. One implication indicates that risk estimates are even more important in evaluating screening and preventive care. As the technology improvement, X-ray radiation has been more precise and accurate, whereas the amount of X-ray has aggrandized 2 times compared as before, which increases the probability of having cancer disease for candidates. To avoid the negative influence of the human body, the costs could be increased significantly by taking more advanced tests. The doctor has to trade off among the accuracy of medication test, the cost, and the healthy influence. There should be an equilibrium position, but the problem is, by how much?
Let's move to the next part, quantification of risk. The quantification of risk can provide data to help us estimate health level and safety level. But for current knowledge, the result of it is still arbitrary. Because the choice of subjects is not necessarily a choice for every individual. And in this part, the author introduces several common ways on probability estimates. The best one comes from a perfect epidemiology study. In this way, the perfect means controlling for confounding factors. This study usually is on the population of interest at the range of dose or exposures of interest. Even this is a perfect way, it are still no human data at all from this kind of study. Because this study always have one or more problems, the following problems, which are too few subjects for confident conclusion, or fail to control for important confounding factors, or there is no data or little data on exposures. So the Environmental Protection Agency, which is EPA in short, classifies it as sufficient limited. The data that we often say from the news or website or articles is often from the laboratory studies. And the probabilities must be estimated from this kind of study. But the EPA is reluctant to use it due to the lower estimated risk. Because the environment in the lab is quite different from the environment that we usually live in. The result may be understate or overstate. So then the author give us some reason on the overestimating and underestimating. On the underestimating, it is most about chemicals. People are exposed to a number of chemicals, so the risk will be the true risk will be the sum of individual chemical risk. It will be much greater than the risk estimates because when we do the risk estimate study, we have to control confounding factors. It may include some number of chemicals that we will met in the true risk. And also each chemicals does not act independently. They will have some interacting part, which is the next point, interaction. So when the interaction appears, the effect of chemicals will be large. Also the true risk. So that's back to the first one. So the true risk is the sum of multiple chemicals and the effect from the chemical interaction. The last one is sensitivity. Different people has different level of sensitivities on same food or same thing. For example, maybe I am more sensitive on sweet. Probably you will be more sensitive also on the chemicals. We will have different reactions. So maybe the risk for me on this chemical is equivalent at the risk estimate, but maybe you will be more will have but maybe you will have more risk on this chemical. Overstate it's mainly about environmental situations. There may be no risk to humans associated with current exposure levels, and the current levels of public concern are not closely aligned to the estimated risk level. In order to understand health and safety risk and the information for better decisions, they also use a very long paragraph on food additives. In food additives, people need to make two choices. One is between risk and health safe. It will be told in the next part, and another one is between properties and needs. Because additives are not that important for someone. The Food and Drug Administration, which is FDA in short, marks the minimal harm line of food additives, which is one concern per million lifetimes. In this policy, if the food additive will increase the chance by less one concerns per million lifetimes, this additive will be considered as small threat or even no threat. There are no restrictions on legal food additives as long as they are within the prescribed range. Many products on the market are also free of additives. Therefore, people can choose to buy food with more additives or with less food additives, or even or even without them, according to their own preference. In this part, the author wants to tell us that people are presumed to be reasonably well informed and to be capable of making their own judgments. That's what the FDA want.
Let's talk about the traumatic injuries and death. Risk assessment has had a long history in the analysis of accident. Safety analysts dislike the term accident since it has a coordinate of being beyond human control. Instead, each trauma injury has a course and steps could have been taken to avoid it or at least mitigate the injury. Risk situations occur in designing safety equipment. One high-safe situation is a controversy over whether airbags should be mandated in cars. There is no denying that airbags would save lives, but the cost per life saved would be about 1 million. A variety of approaches have had been used to assess the frequency and mitigation possibilities. The most important is a statistical analysis to identify the frequency of events and conditions leading to injury or death. Others include crash investigation, injury epidemiology, behavioral feedback, economic approaches, human factors, and more recently, the use of fault and event trains. The last approach is embodied in probabilistic risk analysis, developed for nuclear reactors and now used in other areas. Aside from an speech, no one talks about a limiting trauma that would require banning activities. For all activities, society tries to decrease risk by encouraging safe behavior and safer products. Enhancing safety stops when the cost and inconvenience of increased safety exceeds the benefit of the safety gains. A how decision. Most of this decline is not related to governmental standards and inspection, but rather seems to come from the company and consumer decisions as influenced by legal liability. Risk analysis is done to enlighten decisions about how safe and risk situation. Since the risk estimates have major uncertainties, they may be useless to the risk manager. Providing warning labels and signs does not guarantee that people will read them or understand them. However, there is a basic social choice about the extent to which individuals should be allowed to make their own decisions and to be able to understand the information provided and the consequence of their choices. Some hazards, such as those associated with a nuclear reactor or plant-making pesticides, endanger people in the varsity. The decision concerning where to locate them is inherently social in nature, since the individuals living nearby will have to accept this risk. Some of these people will see the plant as offering a trivial increase in risk, but others will see it as life-threatening because individuals can do little to adjust their risk level. This situation exasperates those who disagree with the social decision. So risk situations require a balancing. This structure precludes the rhetoric about being willing to spend anything to prevent premature death. The how safe situation invites fancy thinking and rhetoric. The issue is not how many pieces of green paper are worth preventing premature death, but rather how much inconvenience and discomfort to bear and how much consumption of other goods and services to give up to lower the probability of decrease or death a little bit more. So what risk levels to set? For guidance on what risk level to set, a variety of approaches has been used. One attempts to find what is a trivial or the minimum risk so that the limited resources for improvement are not wasted to reduce risk beyond this level. A second approach is to examine hazards that are rigidly accepted in everyday life and in regulations. A third is to seek public guidance through references or through the action of elected representatives. It is interpreted to mean both technique and economic feasibility. One of the great advantages of risk management has been bringing the decision process out into the open. Since the probability cannot be lowered to zero, there is good reasons to inform the affected parties and the public of the basis for a decision. The conclusion is risk analysis should not attempt to overstate or understate threats, but rather to give the best estimate and the range of uncertainty. Decision makers can choose the proper amount of conversation in setting the standards. The various federal agents ought to coordinate their risk assessment process so that they will arrive at similar estimate for a particular hazard. Current risk estimates are fraught with uncertainty. The process of conducting and defining risk analysis highlights these uncertainties and suggests a research agenda to resolve them. Rather than refine existing arbitrary assumptions, the process must be open to new data and models, particularly since current assumptions often are based on little or no data. It is inherently easier to manage risk situations than how-safe situations. The former are self-limiting and require an explicit balancing of the risks. The latter are subjected to rhetoric about their risk because there is no necessity to consider what is being sacrificed to lower the probability further. So lastly, here are two questions. The first one is, given risk analysis trade-off between risk reduction and cost, performing an efficiency achievement, where the safety standards requires inefficiency and lack of cost effectiveness. Do you think to contract that risk analysis could help to achieve safety standards? The second is, the article said, since the risk estimates have major uncertainties, they may be useless to the risk manager. Do you think the risk estimate is necessary or not? So that's it. Thank you for listening.